Hello, gentlemen. If you are over 50, 60, or beyond, and you've noticed that your intimate moments feel different, specifically, you reach climax, you feel the full wave of pleasure, but there's little to no fluid released, stop ignoring it. This is not something to brush aside. I'm Dr. Nova Elish, a urologist with over a decade of experience in men's health, and today I need you to hear me clearly. If you are older and do not ejaculate, you must act immediately. Why? Because while this change may feel embarrassing or confusing, it is actually your body sending you a coded message. And if you learn to decode it, you can protect not only your confidence and intimacy, but also your long-term health. Let's start with a crucial distinction. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure, controlled by your brain and nervous system. Ejaculation is the physical release of fluid driven by muscles, glands, and ducts. For most of your life, these two events happen together seamlessly. But as you age, or if certain conditions arise, they can separate. That's when you experience what we call dry ejaculation, pleasure without fluid. Now, I know what you're thinking. Does this mean I've lost my masculinity? Does this mean my intimate life is over? Absolutely not. Your ability to feel pleasure, to connect, and to enjoy intimacy remains intact. What's changed is the mechanical delivery system, and that change has specific causes we can identify, manage, and often treat. The first and most common cause is retrograde ejaculation. Imagine a small muscular valve at the exit of your bladder. During climax, this valve should clamp shut, forcing fluid forward and out. But if the valve is too relaxed, the fluid takes the path of least resistance, backward into the bladder. You still feel the pleasure, but the release is dry. A practical clue? Your urine may appear cloudy right after intimacy because the fluid has mixed with it. Why does this happen? Often after prostate or bladder surgery, or as a side effect of certain medications for high blood pressure, or an enlarged prostate. The medicine works on blood vessels, but it also relaxes that tiny muscle. The second major cause is duct obstruction. Think of your seminal vesicles and glands as factories producing fluid. The ducts are the delivery pipes. If those pipes are blocked, the fluid can't pass. Production continues, but delivery fails. Blockages can result from scarring after infections or, rarely, tiny calcifications like stones forming in the ducts. Symptoms may be subtle, mild pelvic discomfort during climax, or noticing fluid becoming thicker and less abundant over time. The good news? Many obstructions can be cleared, sometimes with medication to reduce inflammation, other times with minimally invasive procedures. The third cause is low testosterone. Testosterone is the fuel for the male reproductive system. It powers desire, sperm production, and the glands that contribute fluid. When testosterone drops significantly, fluid volume decreases, erections may weaken, and climax intensity may fade. This condition, called hypogonadism, is treatable. A simple blood test can confirm it, and carefully managed hormone replacement therapy can restore fluid production, energy, libido, and overall vitality. Gentlemen, while most cases of dry ejaculation are manageable, there are times when this symptom is a red flag. If you suddenly stop ejaculating without explanation, and especially if it's accompanied by pain, blood in the urine or semen, fever, or loss of sensation in the genital area, do not wait. These are urgent signals that require immediate evaluation by a urologist. Serious conditions such as neurological diseases like Parkinson's, uncontrolled diabetes, or in rare cases, urological cancers can interfere with the plumbing or nerve signals that control ejaculation. Acting quickly can make all the difference. Now let's talk about the emotional side. Many men equate the presence of fluid with their masculinity, their performance, their virility. When it disappears, feelings of inadequacy, anxiety, and frustration can take root. I've seen men withdraw from intimacy, fearing judgment, or feeling incomplete. But here's the truth: your ability to feel pleasure, to connect deeply, and to enjoy intimacy does not depend solely on fluid. This is a physiological change, not a personal failure. Understanding that fact lifts an enormous weight. Your intimate life can and should remain a source of joy, and with the right medical support, confidence can be restored. So, what should you do? Here's your action plan. Don't ignore it, investigate it. A sudden or progressive onset of dry ejaculation warrants a visit to a urologist. A simple history, physical exam, and often a blood or urine test are all that's needed for a clear diagnosis. Control underlying conditions. Keep chronic conditions like diabetes, high blood pressure, and cholesterol in check. These directly impact the vascular and nerve health that controls ejaculation. Break the silence. Talk openly with your partner and your doctor. Silence breeds shame. Communication opens the door to solutions. Gentlemen, I want you to hear this clearly. The absence of fluid is not the end of your intimate life. It is a signal from your body that deserves attention. Whether the cause is mechanical, obstructive, or hormonal, solutions exist. Your vitality is not measured in milliliters of fluid. It is measured in your health, your energy, and your ability to live fully and connect deeply. So here's my challenge to you. If you are older and do not ejaculate, act immediately. Don't let doubt or shame stop you from seeking answers. Share this video with a friend, father, or brother. It could change their life. Hit that like button to tell YouTube this message matters. Subscribe to join our growing community of men supporting each other across continents. Gentlemen, your best years are not behind you. They are still ahead. Be proactive, be confident, and stay blessed. I'm Dr. Nova Elish, and I'll see you in the next video.